When do you think about offering surgery, Trevor? When do you think about offering other non-standard medication treatments?
So I look at it in two ways. One, if you look at the data of medication failure, that once you've tried 2 appropriate medications and they failed, your chances of achieving seizure freedom are very, very small. So under that scenario, I will suggest that the patients be evaluated to see if they are candidates for surgery. There are other alternatives to surgery as a treatment for patients, but I think from a seizure freedom standpoint, that's the one treatment that offers the best option for the patient being seizure free. So,
and are there some people who you would tend to move somewhat earlier into that surgical pipeline than others, for
yes,
example?
so again, if you look at the Venn diagram, you know, if they have a focal lesion and they have seizures and they have spikes on the EEG, I will do that much earlier.
So seizures and spikes referable to the lesion.
Referable to lesion. And obviously patients who are non-lesional or have or close to eloquent cortex, my resistance is higher.
And what about diet therapy, Eric? Do you recommend that fairly often?
I use for some of my patients the diet. I still remember when we had that movie, First Do No Harm. I felt it did a lot of harm because it was a misinformation. So the diet is not a natural treatment, but it's an effective therapy for some patients. For some, it's actually the therapy, like for glucose transport deficiency. So there are some places where you have definitely a niche for the diet. My experience is that it can help both kids and adults and all type of seizures. But if diet was easy, we would not have an epidemic of obesity. So it's not easy. When you talk about just taking a pill once a day, and we talk about problems with adherence, adhering to a ketogenic diet is not easy. So there are circumstances where that makes it easy, like a person that is fed through a G-tube. It's super easy to provide that kind of treatment. I think a lot of the misconceptions that eating too fat in the diet is a very high risk for heart disease probably are not correct, because it's different eating a lot of fat when you don't eat carbs, because you're burning that fat all the time. It's effective for some patients, but it's definitely hard. So I would say that less than 0.5% of my patients are receiving that type of therapy.
I must say, even on the adult side, where diet is used far less than in children, we have had some success with it, or at least in getting people to try it. And the obesity epidemic, unfortunately, means that people are somewhat more open to trying diets if they can kill 2 birds with 1 stone. So the modified Atkins diet has been suggested to have some efficacy against seizures and may play a role in weight loss. I must say I've not been terribly impressed by the efficacy, but it's an easy thing to decide that it hasn't worked if someone gives it a fair try after 2 or 3 months, and then you've ticked off that box, and if they've had a nice response, then one could go.